Welcome to our show, Health and Wellness, Myths and Facts. Obesity is one of the world's greatest health crises. While many obese people live with diseases such as diabetes because of their high BMI, not everyone realizes how much their long-term health is at risk. Obesity can significantly increase your risk of many diseases. Obesity and hormones are linked. There are some hormone imbalances that can contribute to weight gain. Also, obesity can cause various hormonal imbalances. Education about obesity is important because obesity is a chronic, complex disease that requires comprehensive and lifelong care. But unfortunately, because of the stigma attached to weight, many people don't think of obesity as a disease that requires treatment. Promoting a healthy lifestyle, not just weight loss, and having an open dialogue with healthcare providers can reduce the likelihood of developing obesity or obesity-related health conditions. We have invited eminent endocrinologists to provide medically accurate advice on preventing and managing obesity. Joining us on the broadcast, we have Dr. Ipsita Ghosh, consultant endocrinologist at Narayana Super Speciality Hospital, EEDF Hospital and Narayan Memorial Hospital from Kolkata. Also on the broadcast, we have Dr. Ashutosh Sonawane, diabetes, thyroid and hormone specialist from the Sarthak Health Clinic, Matrutva Maternity and Thyrodiabetes Clinic in Nashik, and Dr. Shalini Patlolla joining us, who's a consultant endocrinology and diabetology at AIG Hospitals from Hyderabad. I'd like to begin with you, Dr. Ghosh. For the benefit of our viewers, could you break down what is obesity and what are the health problems associated with it?
Good afternoon, viewers. It's a very important question because obesity is a significant problem in India. Around 135 million people are affected by obesity. An estimated 5% population are now considered morbidly obese. So what is obesity? Obesity is a medical condition that occurs when a person's body weight exceeds the normal or healthy range due to excessive fat accumulation. It's typically defined by WHO as having a BMI of around 30 or higher, but Asians, the cutoff is a little lower, that is around 25. That's because of an increased risk factors and comorbidities associated with the Asians. Now, obesity can lead to a range of health problems, which includes type 2 diabetes. There is an insulin is unable to be effectively used to regulate the blood sugar levels. And in India, we have 67% diabetic population having obesity. Obesity also increases the risk of heart disease, stroke, and cardiovascular problem due to excessive strain on the heart and the blood vessels. It can also increase blood pressure, which can damage the blood vessels and can also increase heart disease and stroke. Obesity is a major risk factor for sleep apnea, a condition in which breathing stops and starts during sleep, leading to a poor quality of the sleep and fatigability. For every 1 centimeter increase in the waist circumference, that can increase the sleep apnea incidence by around 10%. Now, obesity can also increase an extra strain on the joints, leading to arthritis, joint pain, and mobility issue. It's known that mobility issues are increased by 6 to 7 times in cases of obesity. Obesity can also lead to respiratory problems like asthma, shortness of breath, and can also lead to certain types of cancer, including breast cancer, colon cancer, and pancreatic cancer. It's said that there is an increased risk of cancer by 34% in male and 31% in female. Obesity can have a significant impact on a person's health and quality of life. And so it's very, very important for us to take steps to prevent it and manage it.
Right. As per Dr. Ghosh, it's clear that people who are obese or overweight are at a much greater risk of developing serious conditions such as heart disease, type 2 diabetes and osteoarthritis, as Dr. Ghosh mentioned. I'd like to take the next question to Dr. Sonawane. Doc, what is hormonal weight gain and what are the causes of hormonal weight gain?
Yes. For the hormonal weight gain, without any reason, with a good lifestyle modification and having proper diet in itself, still you are getting too much of weight gain, then it might be the reason that hormones are the cause. So there are various different hormones which regulates the metabolism, and in that hormonal imbalance, sometimes hormonal deficiency or excess can cause weight gain. The most common cause is being the hypothyroidism, where the thyroid hormones deficiency is there. Sometimes androgen imbalance, hypogonadism also causes weight gain. There is other hormone which excess, like the sorry, cortisol excess also causes the high weight gain. Apart from that, in the young female, PCOS, insulin resistance, these are the reasons for the weight gains. We already discussed the cortisol deficiency. Along with that, in female or post-menopausal female, typically with the deficiency of the estrogen, also can cause the weight gain. So these are the few diseases, few hormonal disorders which leads to the weight gain. Thank you.
Right, so this is your reminder if you've gained weight without an apparent cause to get your hormone levels checked by a professional. But Dr. Patlolla, what are the signs and symptoms of hormonal weight gain, and how is hormonal weight gain diagnosed?
Yeah, good evening everyone. So if we see hypothyroidism and the cortisol excess, where we call it as Cushing syndrome, these are the most common causes of hormonal weight gain. So in hypothyroidism, usually along with weight gain, there will be other symptoms like swelling of the face, swelling of the limbs, and weakness, lethargy. So these are, in addition to weight gain, patients will be having these symptoms. If we come to Cushing's, there will be a deposition of fat more over the abdomen and the neck, and the limbs will be thin. So there is irregular deposition of fat, and also apart from that, there will be appearance of red color stretch marks over the stomach. There will also be proximal muscle weakness. So these are some of the symptoms which suggest that it is a hormonal weight gain. In children, especially if you take if the weight gain is also associated with height gain, then it is a simple obesity. But if the child weight is increasing but the height is not increasing, if the child is short and overweight, then we need to rule out endocrine diseases like hypothyroidism and the Cushing syndrome.
Right. Dr. Ipsita Ghosh, how's PCOS then related to weight gain?
Okay. PCOS or polycystic ovarian syndrome is a hormonal disorder that affects mainly women of reproductive age group. So one of the most common symptom of PCOS is weight gain or difficulty in losing weight. And it's one of the most common causes of female infertility, and it affects around 6 to 12% women in the reproductive age group. Now, PCOS is associated with insulin resistance, which can lead to high insulin levels in the body. And insulin is a hormone that regulates blood sugar levels. So it promotes the storage of fat in the body. So if the insulin levels are high, it is very difficult for the body to break down fat that can be used for energy, and thus leading to weight gain. Now, PCOS is also associated with an increase in the androgen levels, mainly the testosterone. So androgen levels are associated with acne, excessive facial and body hair, but can also affect the way the body stores fat, especially the abdominal obesity, which is again a risk factor for insulin resistance, type 2 diabetes and cardiovascular disease. Again, additionally, women with PCOS have a slower metabolism, which means that it burns fewer calories at rest compared to a woman without PCOS. So all these make losing weight difficult for patients with PCOS.
Right, Dr. Ghosh, lots to unpack there. So there is a direct link between weight gain and polycystic ovary syndrome, and insulin resistance is one of the biggest contributors when it comes to weight gain in women with PCOS. Dr. Sonawane, is it true that hormonal weight gain is potentially reversible, and what are the possible treatments for hormonal weight gain?
Yeah, certainly hormonal disorders. Now, so weight gain because of the hormonal disease is reversible. For that, we need to identify what is the real problem, which hormones is deficient or which hormone excess is there. Just now we have seen there are like hypothyroidism, cortisol excess. So these are the few hormonal changes that lead to weight gain. If we replace or control that hormone levels with the help of endocrinologists, who is the experts in managing this hormonal disorder, certainly we can help and we can reverse their weight gain. So simply replacing the hormone which are deficient, like in hypothyroid, we give the thyroxine or thyroid hormone replacement. Again, those who are having cortisol means steroid hormone excess, with help of proper medicine, we can control. We need to identify the cause. What is the disease or which factors which leads to hormone excess? So if we can find out the cause with that help of endocrinology, definitely we can help. And sometimes even hormonal uh, therapy, like testosterone replacement, those who are having hormone deficiency, that also we can treat. And really it is a reversible.
Right. Dr. Shalini Patlolla, are there preventive steps or measures to avoid hormonal weight gain? Dr. Sonawane has already touched upon it, but can you add to that?
Yeah. So for this hormonal weight gain, there is no such prevention, but early diagnosis will help in prevent further weight gain. So it is important for any obese patient to consult an endocrinologist to get a proper diagnosis. If the diagnosis is early, then we can prevent further weight gain, and this hormonal weight gain is also reversible to some extent. So if the patient is having hypothyroidism and if it is left undiagnosed, if we confirm the diagnosis of hypothyroidism and take thyroid medication, then the weight gain will be reversible to some extent. Same applies to the other hormonal disorders. So early detection is the key here.
Right. Early detection and medically guided remedies will help you avoid and control further weight gain. With that, we're taking a quick break. Our experts stay on with us to give you advice on preventing and managing obesity. We're back with endocrinologists who are here to provide medically accurate advice on managing obesity. Let's go across to Dr. Ghosh, who's with us. Dr. Ghosh, for the benefit of our viewers, are weight loss surgery and liposuction the same? And if not, then what is weight loss surgery exactly?
No, absolutely not. Weight loss surgery and liposuction are not the same procedure. Weight loss surgery is a type of surgery that is designed for people who are obese to lose weight by altering the digestive system. And liposuction is, on the other hand, is actually a cosmetic procedure which is used to remove pockets of fat from specific areas of the body. Now, weight loss surgery, also known as the bariatric surgery, is a major procedure, surgical procedure that involves making broad changes to the digestive system to help the person to lose weight. And the most common types of weight loss surgery are the gastric bypass surgery, sleeve gastrectomy, and adjustable gastric banding. These surgeries help to reduce the size of the stomach and the amount of food, so that they can alter the amount of food that can be eaten and also change the way the body absorbs nutrients. And weight loss surgery is actually recommended for those people who are morbidly obese, that is BMI more than equal to 40, or those with BMI more than equal to 35 but having obesity health related issues. And obviously those patients who are unable to lose weight even after different methods of diet, exercise, and even medications. And liposuction, on the other hand, as mentioned, is a cosmetic surgery designed to remove excessive fat from specific areas of the body like abdomen, hips, thigh or arms. And during the procedure, small incisions are made, and through thin tubes they suck out the fat. So it's not a weight loss surgery, and it's not recommended for people who are obese.
Dr. Ashutosh Sonawane, then how is obesity associated with heart disease?
Okay. Obesity and heart disease is a multifactorial problem. So obesity directly and also indirectly both can affect the heart. So metabolic syndrome, in which obesity is one of the components. So by indirect means, along with the metabolic other problems like deranged cholesterol level, hypertension, diabetes. So these all the factors affect the heart and causes the heart disease. Again, Obesity also causes the obstructive sleep apnea, and obstructive sleep apnea again responsible for hypertension. So these are the indirect or direct means. And being an obese person sets an high inflammation rate. Okay, and that's why high higher inflammation or inflammatory process aggravate this atherosclerosis cascade, and it can damage or harm this cardiovascular system. Again, directly, obesity affects the structural and functional work burden of the heart, and that also leads to cardiovascular disease. So, it is a multifactorial thing, directly as well as indirectly. Both obesity affect this cardiovascular system.
Right. Dr. Shalini Patlolla, what lifestyle measures should one adopt if he or she is already obese with heart disease?
Yeah. So small lifestyle changes can bring big differences in your heart health. American Heart Association recommends at least 150 minutes of brisk walk per week. Apart from that, make healthy food choices, like include more of reduce the carbohydrates, include more whole foods than the sugary or the sweeteners, and also quit smoking, and at least 7 hours of sleep is needed per day. Apart from that, one need to monitor the cholesterol, blood pressure and the diabetes regularly and keep them under control. People do not take diabetes or the cholesterol problems or the obesity seriously until they are affected with a heart attack. So it is way much before you suffer from heart disease, these lifestyle modifications should begin, and you have to keep monitoring your cholesterol, blood pressure and diabetes and take treatment and keep all these under control.
Right, Dr. Patlolla has a long list of advice for us. As per the American Heart Association, as Dr. Patlolla just mentioned, the AHA says that walking at a lively pace for at least 150 minutes a week can help you reduce the risk of heart disease. Also, you have to incorporate a heart-healthy eating plan, and most adults need at least 7 hours of sleep each night, as per Dr. Patlolla's advice. But Dr. Ghosh, does high blood cholesterol levels mean a person is obese?
No. High blood cholesterol never necessarily means that the person is obese. Cholesterol is a type of fat that is found in the blood and is important for the normal functioning of the body. However, when the levels of this cholesterol in the blood becomes too high, it can increase the risk of developing heart disease or other health problems. Obesity, on the other hand, is a medical condition characterized by excessive body fat at different places, and that can lead to a range of health problems including high blood pressure, diabetes and cardiovascular disease. While there is a correlation between obesity and high blood cholesterol levels, but they are not the same thing. Obesity can contribute to high cholesterol levels by increasing the amount of LDL cholesterol, which we know as bad cholesterol in the blood, and decreasing the amount of HDL cholesterol. However, there are other factors that can also affect the cholesterol levels, including genetics, diet and lifestyle. So it is important to have regular cholesterol screenings and consult with a healthcare professional to determine the appropriate course of action if your cholesterol levels are high, and they might involve lifestyle changes like healthy diet and regular exercises along with some medications if necessary.
Right, so obesity is a risk factor for high cholesterol, and if blood cholesterol levels are too high, it does increase the risk of heart diseases, as Dr. Ghosh has just explained. Now, Dr. Sonawane, childhood obesity is an independent risk factor for type 2 diabetes mellitus. Is it true, and how so?
Yes, it's very true. In childhood obesity, these people are very much prone for a diabetes in future. Now, 20 years.
Right.
So the factors responsible for this childhood obesity is a lifestyle problem, having of more junk food and with the least exercise, less physical activity. So these are the factors, and again genetic history, family history is also important. So these are the things which leads to more of diabetes in future in even a younger age.
Right. As you know, the prevalence of childhood obesity has been increasing dramatically. So useful information to unpack there. Dr. Shalini Patlolla, can a person with obesity suffer from an eating disorder?
Yes. Eating disorders frequently associated with obesity are bulimia nervosa and binge eating disorder. So in bulimia nervosa, there will be episodes of binge eating followed by compensatory behaviors like self-induced vomiting. So studies have shown that co-occurrence of these two, like obesity and eating disorders, they potentially exacerbate each other. An individual with obesity and eating disorder is more prone for medical and psychosocial complications than an individual with any one of the disorder. So it is important that we identify these eating disorders in obese patients and try to manage them effectively.
Right, so eating disorders, obesity and other weight-related disorders may overlap, and body dissatisfaction and unhealthy dieting practices are linked to the development of eating disorders, obesity and other problems as well. Dr. Ghosh, what are hormonal imbalances in men, if you can take us through that, and can obesity cause them?
Hormonal imbalances?
In men.
In men. So as has been mentioned earlier, that androgen deficiency can lead to weight gain, especially in the elderly age group. So that's an issue. So we need to treat these patients with hormonal supplements through injections or any other methods. So that can lead to weight loss. And obviously there are other reasons, as has been mentioned, like cortisol excess and thyroid deficiency, which can also lead to an increased weight gain even in men. So these are the important reasons.
Right. Also, Dr. Sonawane, does obesity increase estrogen levels?
Yes, obesity also can increase the estrogen levels because from the fact with the help of aromatase it can cause more of estrogen production. So, like obese female can have a face problem, which is because of this. Even in males, those who are obese, they can have gynecomastia along with the lipomastia. So, certainly, sometimes not only obesity, but high weight along with some insulin resistance and some hormonal metabolism disturbance can increase the estrogen level.
Right. I'd like to take the last question to Dr. Shalini Patlolla. Dr. Patlolla, what role do anti-obesity drugs play in weight reduction?
So the main cornerstone for the treatment of obesity is lifestyle management. Then comes the anti-obesity drugs. We have certain anti-obesity drugs where we use in obese patients whenever the BMI is more than 25 or if it is more than 30. So the anti-obesity drugs we commonly use are the orlistat, which is a lipase inhibitor, or the newly we are using nowadays the semaglutide, the anti-obesity drug, which helps in suppressing the appetite of the patient. So these are all like temporary measures, but obesity treatment as such is obesity is a chronic disease, and we need to monitor the patients along with the lifestyle management. To emphasize the lifestyle management, we can add on the medication, and if the patient fails with the medication, we usually give the medication and observe for 3 months. If there is at least 5% weight loss, then we'll continue the medication. Otherwise, we emphasize.
Right. By our conversation so far, it's clear that even small lifestyle changes can make big differences in your heart health if you stick with them. We hope the experts on the show were able to provide useful advice to you on preventing and managing obesity. Thank you so much for watching at home. Goodbye.